COVID, of course, is the disease on everyone's mind, but kids are dealing with more than just the pandemic this winter. Sonica Bargo joins us with more on why this year's flu season is different. Sonica.
Dennis, part of the difference is that we're seeing a flu season at all after a massive drop in flu cases in 2020. But this year, doctors are seeing more kids than normal getting sick. The flu season in 2020 was nearly non-existent.
We didn't see the usual kind of respiratory viruses that we typically see.
But when COVID precautions started to lift, things changed.
People kind of getting together and going back to school, daycares, things like that.
Pediatric infectious disease physician Patrick Gavigan says the number of kids getting sick with respiratory viruses other than COVID started to rise faster than doctors expected.
Usually, again, those kind of start in the winter months, but we really started seeing, high RSV activity as early as June, July.
Gavigan says one reason for the rapid rise is because so many kids spent over a year at home, mostly isolated.
Usually each year, new kids are exposed to it. They develop some immunity towards it.
Doctors have the most data on respiratory viruses, but Gavigan says there could be a rise in other infections as well.
Anecdotal reports of, people seeing increases in bacterial infections and things like that.
Once schools return to a consistent in-person schedule, Gavigan expects numbers to settle.
My best guess is that it would kind of go back to what we had seen pre-pandemic.
Until then, families can still take precautions, just like they've been doing with COVID-19.
The usual pediatric vaccines, flu vaccine is important and helpful.
Gavigan also told me with all of those viruses going around, it can be hard to tell what your kid is dealing with. He says continue to monitor their symptoms the same way you would with COVID, like making sure they're not having trouble breathing. Live in the newsroom, Sonica Bargo, ABC 27 News.
Thank you, Sonica.